And you can feel that. Scoop, internally rotate. Drag, scoop. Belt definitely makes this easier. Scoop.
Not as strong.
Internally rotate. One more. Good. Scoop back on the middle of the table. Take a look just to see what the distraction did. Just to see. And then I like, at least we're getting some motion here, which is good. You can see, square your body up so you're not like, now you're the other way. Now you're the other way. Straight with the table, just like, good, just like that. Relax. So I remember I didn't like this internal rotation. I still think I can get more here. So what I'll do is go back to this figure 4. I'm gonna go compression, and I do a contract relax here. I'm gonna compress. I'm gonna start him in external rotation. I'm gonna start to take him in internal rotation. As I go internal, he's gonna try and go external. So watch. So I relax. Now, I'm gonna go this way. You push that way. And then you relax. And don't let me get to any pain. And you relax. Relax. Go for it. And relax. Now I'm doing more capsule, TD, both together. Go for it. And relax. Relax. Go for it. You okay? And I'm kind of doing that compressive into the joint this way, like you saw a second ago, here this way. And relax.
And you're internally rotating him, and he's fighting against you?
I am, yes. He's trying to external, I'm trying to go internal. And I'm not letting him win. Right, but you start to see what kind of gains, and I keep looking to see what kind of gains I'm getting on that internal. Relax. Still have more on this side, but I'm getting there. So I would keep going. Okay, so I scoop, contract, relax. That's when I turn around, face down. I'm gonna go after that anterior capsule. Now we're gonna go over and I'm gonna do some compressions, try and break that anterior capsule up. And again, more based on my palpation. You okay? So I start with the anterior capsule this way again. Full press. I like this table to be a little lower so I get a full compression. Then I'm going to take his leg this way. And we're going to go across. I'm going to grab onto that greater trochanter and I'm going to push down. If I wasn't holding here, this would hit me in the stomach. Just so we're on the same page. This is like this way. So I'm compressing as hard as I can. You okay?
Are you going straight down?
I'm going straight down. I'm going straight down this way. Really using the greater trochanter to do that. It's almost like a contract relax on my own. I'm resisting and trying to boom this way. Okay, I would then probably, based on this, I'd probably do some of the ART work, somebody showed, on your, let's go facing me this way. Go all the way towards the edge. So I would probably, just based on what I'm saying, closer to the edge there a little bit, you're gonna take this leg's gonna go up like this, back and forth. This bottom leg can bend just a little bit to keep yourself, so you're gonna go this way. I'm gonna work external rotation here a little bit first. I'm gonna get in here. We can go after any of these rotators here, these intrinsics. We'll figure out which one I want to find palpation. I'll try to figure out which one's tightening up more than the others. I'll attack this, and what he'll do is he'll go up. As I'm working these muscles, bring the leg back. So you're just gonna go like this. Boom,
Okay, gotcha.
and boom, back and forth.
Yeah.
First, like let's say 3 times like this. Okay, then I'll tell you what to do next. Go forward, I just want to feel first. Just go slower, slower, slower. Knee up to your chest. So this foot's got to get past that table up there. Okay. I'm just palpating. Go ahead. And back. Just trying to feel tissue tension to see if I feel one worse than the other. Okay. Now as you do that, here's what you're going to do. You're going to bring the knee to the chest, and then you're going to take this foot and you're going to drop this foot down, externally rotate. Okay. There we go. Chest. Externally rotate. Again. Going. And back. I'm just, again, just palpating. Now, you're going to bring your knee up this way, and now I want to let your foot go up. Back. Checking all planes. I actually feel better this way than external in this position with the hip flex. It almost changes. Like I got more internal now with the hip going across, which tells me something, right? Okay, so go forward again and come back. Okay, now I do a little weird thing here. to me, I feel like I've got more of an external rotation when the knee gets up. And I feel like as he brings his leg back, I even have some of the front of the hip. So I'm kind of feeling like when the hip flexes, I try to pay attention to my hands like this. Thumbs feeling back here, fingers are feeling up here. Okay, I do a lot of these broad-based contacts, just trying to feel. That's just something I got a lot of experience doing. I look for what's happening on the contractile side versus the elongating side, and seeing what kind of stops me first. So here's what I mean. If he brings his leg up, and he gets to the point here where all of a sudden, look, all he's doing is flattening lumbar spine. When he gets about right here, he starts running out of his range, he starts flattening his lumbar spine. So I'm going, what in the hip is preventing me from doing this? If I feel this tighten up first, I'm thinking TED. If I feel nothing tightening up here, but it feels like it's tightening up over here, I'm thinking JD. Does that make sense? Hope so. Okay, so that's kind of what I'm feeling here. So I'm going to try and do a little work on the back and on the front with you on this in different directions. So I almost put my hand in a place where I'm going to go across the front of the capsule in the front. I'm going to go over some of the muscles in the back. As he goes forward, like you're going to bring your knee this way, I'm going to resist some of these rotators as he goes this way and drops the foot. And then as he comes back, I'm going to open up the anterior hip as he goes back with the front of my finger. Almost like a double bang for your buck. Does that make sense? Okay, so go for it, just so you can see what it feels like. And then drop the foot down, all the way down, and then come on back. Oh, so when I say come on back, foot comes up, and then you're gonna come back. Okay, go for it. And if you, like we said before, if you have somebody that's here, there, that can help you in the clinic, you can kind of guide the foot. And as you come back, you can feel the front of the hip, and as you go forward, you're gonna feel the posterior. Go for it.
Yeah, exactly.
And drop the foot down. And then back.